lot of women within the childbearing age are faced with different medical conditions which are related to reproductive health and which mostly get them scared. A large number of these women do not know how to describe these happening conditions. Some are even so ashamed to discuss this with a partner, even a medical practitioner. One of these varying medical conditions is called menorrhagia. And this brings us to the question, what is menorrhagia? Good day viewers, today I'll be discussing with you the topic menorrhagia, the causes, how it could be identified, and its possible treatment and management. If you have any question during the course of this discussion or you feel like sharing your experience with us, please drop them in the comment section below. And if you are coming across my video for the very first time, don't hesitate to click on the follow button so that you can avail yourself the opportunity to always have access to my videos. Now let's get started. What is menorrhagia? Menorrhagia is an unusually heavy or prolonged bleeding lasting more than 7 to 8 days. It can also be described as an unusually heavy bleeding which causes you to soak through 1 or 2 tampons or pads every hour for several hours in a row with the passage of blood clots or more than 1 day of your period. An average or normal blood loss during menstrual bleeding is about 2 to 3 teaspoons, which is equivalent to 20 to 30 ml over 4 to 5 days maximum. Having an unusually heavy menstrual flow can interrupt the normal daily life, and in some cases it can denote a more serious health problem. An untreated menorrhagia can lead to anemia, which is the reduction in the quantity and the quality of blood in the body, and it can come with the symptoms like weakness of the body, dizziness, chest pain, and fatigue. And here are some of the medical conditions that can cause heavy menstrual bleeding, that is menorrhagia. Number 1 on the list, we have uterine fibroid. Number 2, we have uterine polyps. And number 3, we have irregular ovulation, which might be due to hormonal imbalance. And number 4 on the list, we have adenomyosis, a medical condition which involves the endometrial tissue existing within and also growing into the uterine wall. Number 5, we have a non-hormonal intrauterine contraceptive device, a type of birth control devices which is inserted into the uterus. This can lead to uterine bleeding. Number 6 on the list, we have pelvic inflammatory disease. This is an infection of the reproductive organ resulting from poorly treated or untreated sexually transmitted infections. And number 7, we have pregnancy complications such as loss of pregnancy and ectopic pregnancy. Both can lead to unusually heavy bleeding. And lastly, we have cancer, which might include cervical cancer, uterine cancer, and ovarian cancer, as well as some certain medications like anti-inflammatory drugs and anticoagulants. All these can be responsible for unusually heavy menstrual bleeding. Then, how do we treat this medical condition? Treatment options for menorrhagia will depend majorly on individual case and the underlying cause of the bleeding. You are hereby advised to visit your doctor or a medical professional if you are experiencing unusually or prolonged heavy bleeding. So as to determine the cause of your bleeding, putting the following into consideration: your age, general health, and your medical history, as well as preferences and your needs regarding menstruation. Thanks for watching, and here we shall call it a day. And don't forget to like and share this video with your friends. Bye.